In this chapter, there's a lot of theories and therapies for nursing practice, and the theories are going to be reviewed. You've had them in your psych class, and you've had them in your fundamentals courses. You may have even had some of it in your, those of you who are transitions, in your maternal newborn class as well. So if you're not familiar with them, you might want to go back through and review, and I do have some of that here, but I'm not going to go deep into the different theorists and their theories because it is review. So please make sure to go back through there, and if you feel like you're weak in those areas, please go back and look over those again. One thing I do want to remind you about is when we talk about the theories, and we're getting ready to go into psychoanalytic theories, remember, psychological theories help us to explain behaviors, where your psychological therapies are usually your treatments based on these theories. So if you can keep those straight, your psychological theories help us to explain behavior, where psychological therapies are treatments based on their theories. One of the psychoanalytical theories is Freud. He is the theorist who thought about the levels of awareness, and he says the conscious part of the mind is going to contain all the material that a person is always aware of at any one time. These are their perceptions, memories, thoughts, fantasies, and feelings. The preconscious is just below the level of awareness and contains material easily retrieved through conscious effort. And then the unconscious level is all the repressed memory, passions, and unacceptable urges. He believes that memories and emotions are associated with trauma are placed here because they're too painful to deal with. Here's where defense mechanisms and anxieties come up, and they operate on an unconscious level. And he says denying, falsifying, or distortion of reality is used to make it less threatening. So what Freud believes is that experiences during the early stages of our lifetime determine our adjustments to patterns and that happened in our lifetime, and to our personality traits. So here, by considering the conscious and the unconscious influences, a nurse can actually identify and begin to think about the root causes of a patient's suffering. Some of the things that we have are attentive listening, and this is just actually being there and confirming that you do hear what they're saying. You're not just there as a presence, but you're actually paying attention to your patient. Transference, this helps in the exploration of feelings. So it refers to feelings a patient has towards the healthcare workers that originally held towards actually significant others in his or his life. Maybe the nurse looks like a parent who abused this patient earlier in life, and so they transfer those feelings and thoughts towards that coworker because they just don't like them, and because it reminds them of them. They remind them of that person. Countertransference are unconscious feelings that actually the nurse has towards the patient. It's a reminder of someone that they do not like. And so unconsciously they react to the patient as if they were that individual. So it can happen both ways. So you have transference and countertransference. Please make sure to keep those two straight. Look at this case study and see what you think and what's going on. I'll bet you remember Erikson and how personality continues to develop throughout life, and the 8 stages of development that he created. And he says, using this theory and developmental model, it helps us to determine what types of interventions are most likely going to be effective, depending on the age and the developmental level of our patients. Sullivan has an interpersonal theory and says that the purpose of all behavior is to get whatever needs that we have, get them met through some type of interpersonal interaction, and also we want to avoid, reduce anxiety. So we have anxiety, which are your feelings or emotions that are painful that might come from social insecurity or prevents any type of biological needs from being satisfied. Security operations are measures an individual takes to reduce their anxiety and to gain some type of security. Sullivan did found his theory from Hildegard, Peplau's theory, and it says by being a patient observer, one shows mutuality, respect for the patient, unconditional acceptance, and empathy. It's proposed that the interpersonal theory of personality development, so it focuses on interpersonal processes that can be observed in a social framework. So we're looking back at this individual and being accepting and trying to understand where they're coming from and showing them respect and understanding their feelings, and then what that may have developed into what is their personality now. Now Peplau is based on Sullivan's interpersonal theory, and Peplau is considered the mother of psychiatric mental health nursing. She said the art of nursing is to provide care, compassion, and advocacy for our patients and improve their comfort and well-being. It's also the science of nursing, the application of knowledge to understand a broad range of human problems and psychosocial phenomena, and to interviewing and relieving a patient's suffering and growth and promote their growth and development. An interpersonal theoretical framework that's actually become the foundation of psychiatric mental health care today. So using this with theoretical relationships, it describes different levels of anxiety and how they can affect perception and learning. It's also used to promote interventions to lower patients' anxiety and aim to improve their ability to think and function at a more satisfactory level. Next we have behavior theories, and some of these are your conditioning theories and behavior theories. These are based on changing maladaptive behaviors that a patient has. It works best when it's directed at a specific problem, and you have well-defined goals for those patients. Its implications for nursing is that we're going to either modify or replace behaviors, or we use it for behavior management. You're going to want to look up these terms and make sure you have an understanding for them, so when you see them, you know the background. Modeling is done through learning through imitation, where your operant conditioning is behavior modification when voluntary behaviors are increased or decreased through positive reinforcement, negative reinforcement, or punishment. Systematic desensitization. This is the development of behavior tasks as they are customized to a patient-specific fears. So the patient is gradually exposed while using relaxation techniques. Aversion therapy is more drastic. They use noxious stimulants, punishment, or expose them to something, and they might even use just complete avoidance to keep from being exposed. So the needs are ongoing. Supervision, support, and evaluation is used. Systemic desensitization would be, I have a fear of flying, so every time I go on a trip, someone has me go on a plane to eventually desensitize me, or if putting me in an elevator, I'm claustrophobic as well, so I don't like being in closed areas, but everywhere we went, I would be in an elevator, and they would add more and more people to that elevator to where I'm more closed in, and so that would be a type of systemic desensitization. Biofeedback, this is a technique that's used for gaining control over unconscious body functions such as the blood pressure or maybe a heartbeat. Individuals can learn to monitor and control responses by the use of sensitive instruments that can provide information on body functioning, such as someone talks to themselves out, they feel an anxiety or panic attack coming on, and they can actually use techniques to talk themselves down or help them to relax. Now, cognitive theory, these are thoughts that come before feelings and actions. So the thoughts about the world and our place in it are based on just our own unique perspectives, which may or may not be based on reality. So it can be something that someone dreams up or thinks of, and it's in their mind. Cognitive distortion, those are thoughts that are absolutely irrational, and they lead to false assumptions and misinterpretations. With cognitive theories, there's two. There's rational and emotive behavior therapy by Ellis and cognitive behavioral therapy by Back. And with the rational and emotive behavior, this aims to eradicate any irrational beliefs and recognizes that that their thoughts are not accurate. So this believes that the perception influences all their thoughts, which in turn influences our behaviors. An example could be feeling that the glass is half empty, or people who feel like the glass is half full. It's their perceptions and how they believe, and it influences their thoughts and their lifestyle, depending on what type of person you are. Are you a glass half empty person, or are you a glass half full? Your cognitive behavior therapy by Beck, it tests distorted beliefs, and it tries to change the way of thinking. So they want to reduce symptoms. They looked at depression. They were trying to relieve the symptoms of depression. It's based on the principle that feelings and behaviors are largely determined by the way people think about the world and their place in it. And their cognition is based on attitudes or assumptions that develops it. So through their developmental forms, attitudes and assumptions and their ways of thinking, is it nature or is it nurture? Is it something that's within them, or is it their environment, maybe their household and their surroundings were very negative or maybe very positive. And remember Maslow's hierarchy of needs, and saying that humans are striving to be participants in life and striving for self-actualization. And remember, that was at the very tip top of the triangle. And so we have to work our way up. So the most important thing right now is meeting our needs. And those are when those are met, then we move on to the next level. So the emphasis is on human potential and our patient's strengths, prioritizing nursing actions and the nurse-patient relationship. And your physiological takes top priority, even though it's the top priority. It's not the top of the triangle, it's actually the bottom, because these are the major ones that we need to meet first. Page 31 through 33 actually reviews the model. When you go through and look at the hierarchy of needs, and you actually have the figure on page 32, and then the implications for nursing is on page 33. When we look at the biological theories, it's how the body and the brain are going to interact to create emotions, memories, and perceptual experiences. This perception views abnormal behavior as a part of a disease process or a defect and seeks to stop or alter it. A target site is located and treated with drugs, diet, or surgery. A person cannot be responsible for their illness just as someone is, going to be responsible for heart disease and diabetes. So again, this is part of your biological theories. So how do we use it in nursing? We focus on the qualities of a therapeutic relationship, understanding our patient's perspective, and communicating to facilitate their recovery. An additional therapy you're going to see and you're going to hear throughout this textbook is Maslow therapy. And it is the total environment. So I want you to pay attention when you go to any mental health facilities. It's actually how the place is set up. Colors, lighting, furniture, where people are, can really make a difference. The environment provides opportunities for growth and healing. It's going to include people such as the staff and the patients. And it takes naturally occurring events and events in the environment and uses them as learning opportunities. You have safe houses for abused individuals. You have safe environments for those with Alzheimer's, or your suicidal patients would be some of the examples. Here's some of your audience response questions. Go ahead and look at these on the next slides and see how you do.